Hello, welcome. I'm Christy, and if you are finding me through Substack, I am Bumbling Buddhist, and my podcast will be posted here as well as on YouTube. I want to thank you for sharing your time with me. I hope you find the content here helpful, if not entertaining. And if you are coming back, I want to thank you so much for coming back and for continuing to support my work. Just to get some housekeeping out of the way. If you are visiting for the first time and you like what you see, please consider liking the video on YouTube and subscribing. Or if you are seeing this on Substack, just give this a little heart so that this can go more into the algorithm and get out to folks that it may help. Also, if you want to continue to support my work beyond that, my coffee site is going to be listed in the description of this video where you can donate. Also, there will be some artwork that is coming up for sale. I'll be adding some things to that site soon as well, so I'll be letting you guys know about that. Okay, so I'm going to try to start chipping away at the HR1 bill, specifically as it pertains to North Carolina. I'm going to be reading a good bit of this from my computer screen, so forgive me that I'm not looking directly at the camera. My camera is actually a good bit above my computer, so I often forget to look at it. I'm working on that. So, okay, let's see here. July 3rd, 2025, HR1 was passed through the 119th Congress. It passed by a slim margin, with North Carolina Senator Tom Tillis voting no after giving vocal opposition on the Senate floor. And the members that were voicing opposition to the bill cited some deep cuts to social safety programs, including Medicaid and Supplemental Nutrition Assistance Plan benefits, and that's your SNAP program benefits for groceries, WIC, things like that. So prior to the passage of this bill, a letter was sent by North Carolina Governor Josh Stein to the North Carolina Congressional Delegation. He outlined the threats that this bill poses to the people of North Carolina. Also, Senator Tom Tillis had a exchange with HHS Secretary Robert F. Kennedy Jr. during the Senate Finance Committee meeting last week, and he had several specific questions that he wanted Secretary Kennedy's staff to let him know about, not the least of which was how HR1 was going to impact the rural communities in our area. I got a form letter back from his office last week that my understanding of what that letter said is that they're still waiting, which I anticipated. I'm going to continue to follow up on that, and if I hear anything more about what is happening with that, then I will definitely let you know. Okay, so the other thing that's happening in the background as it pertains to North Carolina is our state budget. So that process has been at a stalemate for quite some time. Our lawmakers passed a mini budget on July 31st. It would fund some critical programs, including Medicaid, construction projects, and funding for new DMV offices. So, unless the North Carolina General Assembly adopts a fiscal plan where the state takes on some of the burden from these federal cuts, the financial responsibility could fall to the counties. Now, this is really kind of a no-win, so hear me out on all of this. Should that happen, then it would lead to counties raising property taxes to cover this cost. Now, if you're in my county, which I'm pretty close to Mecklenburg, or Wake County, any of the counties where there are the more larger metropolitan areas, chances are you've already had some tax increases, property tax increases. I know we have. So it's just going to be more beyond that because whatever's going to be incorporated into this budget is not going to include what we're also going to have to take on in the future years, just because there's really not a big estimate on that yet. So, okay. So I'll outline later, even with the state taking on some of the burden of this federal cuts, the state funding that would offset that expense will also lead to many North Carolinians losing health insurance coverage under Medicaid. Again, this is a double-edged sword, and it's pretty yeah, it's ugly. Okay, so what I have, according to the governor's office, more than 500,000 people could lose health coverage because of changes to the ACA marketplace and Medicaid. Changes in SNAP, the Supplemental Nutrition Assistance Program, could leave 1.4 million North Carolina residents, 600,000 of whom are children, without food assistance. Tens of thousands of North Carolinians employed in the clean energy industry could lose their jobs because of loss of clean energy tax credits, and some households could see annual electricity costs increase by 18% due to removal of tax credits for solar and wind energy. Okay, so these Medicaid work requirements, these will come into effect beginning on December 31st, 2026, conveniently, very comfortably after the midterm elections. These requirements involve most able bodied adults participating in Medicaid to prove that they are either working, attending school, or volunteering at least 80 hours a month. Now, state officials estimate that just the paperwork, the red tape of this alone could lead to over 255,000 people losing their coverage. Not because they're not employed, but just because of not being able to navigate the system. So, the head of Medicaid for North Carolina, Jay Ludlam, reported that this work requirement will also force the state to develop a system that will verify the employment status of these beneficiaries. I didn't find any mentions in the research that I did as far as like how they would verify school or volunteer hours. Um, Unfortunately, I guess that's probably going to be on paper. I hope that that's something that they can incorporate into the system. But from all that I'm seeing, what they're really focusing right now is verifying employment. So this system that they're going to have to come up with is going to cost money. And it will also be putting a huge strain along with local DSS offices. These offices already have backlogs, they're already short staffed. I mean, ask anybody that is a social worker. I'm sure many of them have done time at DSS. Um, I know there are some very, very wonderful and special people that still work there. God bless you. Um, so, yeah. Okay. So, to add insult to injury, this is just getting better and better. HR1 provides no federal funding to help implement this work requirement, and it limits the state's ability to offset this cost by reducing the cap on taxes that the state imposes on providers to draw down these federal matching funds. The way this works is that if you're a doctor or hospital clinic, whatever, in North Carolina, currently there's a 6% tax. So you pay that tax, that helps to offset whatever the state is holding as far as these expenses, and it allows that provider to be able to draw down the Medicaid funds. Now, HR1 says that the state can't charge that 6% anymore. They can only charge 3.5%. So this is going to cost billions for the state of North Carolina. This combination of the lower provider tax cap along with the work requirement that will likely undo that Medicaid expansion that the General Assembly passed in 2023. So what that expansion did was it allowed many people that previously didn't meet the income requirement in North Carolina, and hold on this one because it's not the big jump that they make it sound like, but so it raised this income requirement. To keep things in perspective, that expansion had increased this income requirement from, let's see, $21,597 per year to $36,777 per year for a family of three. A family of three. So, here's the twist. All who were able to qualify for Medicaid under this new expanded income threshold, they could lose their coverage altogether because of a clause that was added to this 2023 expansion. It said that the expansion would be discontinued if the state is forced to pick up any of the costs. So that's pretty clear. And I also am leaving the text of that bill in the description so you can take a look at that as well. Okay, so in North Carolina, Medicaid programs are already being cut 3%. Along with this, many programs will have an increased cut of 8 to 10%. So before we get into that, I want to take a little detour just to kind of bring this home as far as where we are with this. So on August 22nd, in here in North Carolina in Charlotte, a Irina Zarutska, a Ukrainian refugee, she was traveling home from work on a commuter train in Charlotte, and she was stabbed to death. The suspect, Carlos Brown, has been arrested and is charged with her killing. There's an ABC interview that was done with the suspect's mom, and I thought it was very timely. Um, there have been several reports with political pundits saying that the suspect should not have been on the streets. And I think I had seen a North Carolina FBI special agent in this particular article who said that. And it turns out that his mom agrees with that. Um, and she tried several times to get help for him. So his mom said that he had been incarcerated before, he had been arrested numerous times, and he had a diagnosis of schizophrenia. So what the mom said was that the suspect started refusing his medication, and at the time was under her and her husband's care, and she had become increasingly concerned about their safety. They tried taking him to a mental health hospital. They were told that they didn't have enough room to admit him, and because he was not threatening to hurt himself, they could not take him. The hospital did say that if she got an order from a magistrate that he could be involuntarily committed, and so she did go that route. She got an order from a magistrate to get her son some help. A mental health facility admitted him, kept him for 14 days, and released him back to their care. And again, back in the same situation, he was becoming increasingly violent. He was not taking his medication. And so, what the suspect's mom said was that they eventually had to take him to a shelter. And I guess after taking him to the shelter, he ended up being homeless on this commuter train. So I want to put that put a pin in that. Some of the services that will have a 10% cut is includes inpatient hospital stays, outpatient hospital stays, typically for behavioral health patients, and the PRTFs. These are psychiatric residential treatment facilities. Now, what these are, they house individuals who can't live on their own, who either they're violent, they require high levels of supervision, medication support, and you've probably seen a lot of these places. I know when I worked in home health, I did like supervisory visits, and basically there would be two, three, four of these residents in a home, and there would be full-time staff around the clock there that would take care of their medications, their activities, their daily routines, and that type thing. Um, a lot of these homes were staffed by agencies because there just weren't enough people to do the work. So already, we're facing that. So I wanted to put that out there because I know there have been a lot of people who have said the answer is more police or National Guard or whatever have you. And, then there are a lot of people saying that the problem that we have with violence in this country has a lot to do with mental health. You're kind of kneecapping anything that we can do about mental health when you pass legislation that, takes a bad system and just wrecks it a little bit more. So the reason that I want to get this information out is that I feel like we still have time. I don't until December 31st of next year, after the midterms and when this is supposed to become official, we have time to try to contact our electeds, let them know that we need some legislation to try to offset some of these cuts, that we need to get a budget passed so we know what we're facing. And right now, we don't even really know what we're fighting because we don't have a budget. So we don't know what the impacts are going to be. And the HHS secretary isn't being very forthcoming with that information. So we have work to do. And yes, we elect people to serve in positions. We essentially hire these people to do this work. Right now, they're not doing it, and that's, I guess, part of the work that we have as the citizens of this country. So I'm going to be following this with a deeper dive into specific healthcare populations, including and specifically long-term care. And again, I'm going to keep watching the North Carolina General Assembly to see if there's any updates on the budget debate. So again, I truly appreciate you sharing your time with me, and I will be posting other updates soon. And until then, honor the place in you where the universe resides, that place of love, light, peace, and truth. Honor the place in you that is the same in me. Namaste. You guys take care.